can become the first state to protect villages from the post-antibiotic crisis. I am reaching out because I was told something very important, that it listens to people, takes bold risks, and is prepared to implement policies that can benefit humanity. That is why I felt I must contact you. Today, the world is quietly heading towards one of the greatest healthcare threats humanity has ever faced: antimicrobial resistance, or AMR. Hospitals and healthcare centers are increasingly becoming places where vulnerable individuals can acquire dangerous resistant organisms. Antibiotics, which once saved millions of lives, are losing their effectiveness. In my professional judgment, the crisis will become much more evident by 2028, when unnecessary visits to hospitals, clinics, and doctors' offices may become risky for ordinary families. The poor will suffer first: the illiterate villager, the mother with a sick child, the elderly person with a fever, the battered housewife with no guidance, the frightened parent of a child with physical, mental, behavioral, or learning difficulties. These are the people who will be left helpless unless we establish a new system now. That is why I developed the Prima kiosk, powered by Dr. Maya AI. I am Dr. Kadiali Srivatsa, a retired NHS physician, pediatrician, innovator, the Prima kiosk. This is not merely a machine, it is a village-level human protection system. A Prima kiosk can be installed in villages, pharmacies, markets, community centers, hospitals, bus stations, and panchayat areas. It can communicate with people in their own language and guide them when they are frightened. It can assist in determining whether they need a doctor, a nurse, a chemist, isolation, family support, counseling, or emergency care. It can lessen unnecessary hospital visits, reduce healthcare costs, decrease panic, and prevent misuse of antibiotics. It can help identify infection clusters early and support mothers, children, the elderly, and women in distress. It can create employment at the village level, especially for trained women operators. Additionally, it makes healthcare guidance accessible to those who cannot read, cannot travel, cannot afford private consultations, and cannot wait in crowded hospitals. This is why Andhra Pradesh has the potential to become the first government in history to implement a citizen-powered AI health protection network before the AMR crisis overwhelms the system. You have already expressed interest in rural development, technology, village empowerment, and people-centered governance. The Prima kiosk aligns perfectly with that vision. It is not about replacing doctors, it is about supporting them, reducing hospital overload, and shielding ordinary families from fear, ignorance, infection, and exploitation. I am here to develop a research project using AI to support parents of children with physical, mental, psychological, behavioral, and learning challenges. Many children are wrongly labeled because professionals do not always listen carefully to the parents' accounts. Some children who seem to have learning difficulties may actually have medical issues. Some may have psychological trauma. Others might need early guidance rather than punishment or neglect. Dr. Maya AI is designed to listen to the story, identify patterns, and guide the parent towards the correct course of action. Imagine if Andhra Pradesh became the first state to integrate this approach with Prima kiosks in villages. A mother in a remote village could seek help before her child's condition worsens. A poor family could receive guidance before selling jewelry for unnecessary treatment. A frightened woman might find her voice when she has no one else to trust. A health worker could identify infection patterns before they turn into outbreaks. A government might detect early warning signals before hospitals become overwhelmed. This is not charity. This is intelligent governance. This is prevention before collapse. This is Dharma in action.